Hi, welcome to Big Rock Labradoodles. I'm Alana Holst, and start again, please. Hi, I'm Alana from Big Rock Labradoodles. Thank you again for choosing to work with us in adopting your new wonderful Woofie. We know that you do have choices, and we appreciate you working with us. I sound like WestJet. So welcome to our Big Rock Puppy Booklet. This is what will come home with you on Puppy Pickup Day. Normally we do this presentation, if you will, at Puppy Visitation Day, but we found that I've said it so many times I start to go faster and faster, and it's a lot of information, and I don't want anybody to miss it. So this way you're able to listen to it again if you need to, and really be able to absorb everything I'm telling you, and then you can have time to come up with more questions that you may have for when you do come to Puppy Visitation, and there'll be time to answer those questions. So let's begin. These are all the things that are going to come in the folder for your puppy. So I'm going to walk you through each thing one by one. This is a grooming card that we've had made up that shows what the dog should look like as an adult, and there are tips on the back for a groomer on how to achieve that haircut. This is our puppy pamphlet. It's a 35-page comprehensive booklet that we've put together about the history of a dog and why we feed raw and vaccination protocols, some basic training stuff. It's just a helpful booklet. Hopefully you'll read it. This is our family group on Facebook. If you missed it somehow in our correspondence, it's We Rock with our Big Rock Labradoodle, and any one of our families is welcomed and encouraged to join the group. It's an active group. You can post on there looking for referrals, setting up play dates, just advice from other family members, things like that. They're great. They'll get back to you. Quite a few of the members are very active, and it's just a nice place to have to talk to other people with one of your puppies. This is the veterinary care information sheet. So this is something you'll want to have with you when you first go to the vet. It reminds you that your puppy was dewormed at 5 and 8 weeks with a product called Panicure. Your vet will definitely ask you about that. Also a reminder that we do not vaccinate here. So you're taking home a puppy that has not been vaccinated. The reason for that is we're a natural rearing breeder. Puppies up to about 11 weeks of age, 10 to 11 weeks of age, have mom's immunity still in place. There is no vaccine on the market that can or should bump out mom's immunity. You would literally be vaccinating for no reason. It wouldn't do any good because it can't get past the immunity that's already there. So first vaccine that we recommend is between 9.5 to 10 weeks, but I'll cover that on the vaccine page. The next thing is that your puppy was sterilized between the ages of 7 and 8 weeks, generally just a few days before they go home. So for girls, that's an ovary-sparing spay, and for boys, that's a vasectomy. We do have the page on our website that covers what that really means. And hopefully you've read the sterilization page. There is no physiological reason to ever neuter a male. There are, behaviors that can get going with males that are left intact. We haven't found it to be a tremendous problem in our breed. There are certainly breeds that is a bigger problem. If those behaviors ever got underway, then of course you could go and have a full neuter done, but we would really encourage everyone to hold out until your dog is 2, and you're not going to see those male behaviors getting going before the age of 2. Typically they'll roll in around the age of 3 or 4, if at all. A lot of good training and obedience in the forefront is going to help you not have those behaviors later in life right from the start. So that's always a good way to go. Prevention. We really don't recommend deworming at all. We deworm the puppies and the moms while they're here so that they're not sharing worms back and forth. Beyond that, we really don't do any deworming with our dogs. With the raw fed protocol, they're very, very healthy. They're not particularly prone to a lot of these pest problems that you see in some dogs, which takes us on to the next piece here is about flea and tick prevention. That is just pesticides. Whatever your vet tries to give you, a Seresto collar, Revolution that you pour on the back, Heart Guard that the dog eats, it is basically just pesticide. A lot of this stuff has been linked to higher cancer risks, and in some cases actually linked to bladder cancer. It would be kind of the equivalent of having your child go out and roll around in the golf course in the spring. And I don't say that lightly. We really do 100% believe that these things cause cancer. So we don't recommend them at all. The next one will say what your puppy weighs on.
Carry on, but I'm dying here.
The next, my cameraman is dying, my camera woman. The next one here says what your puppy will weigh on home day in pounds and ounces. And then it will tell you what puppy needs for raw food to be fed at that time based on that weight. And that'll be 10% of puppy's body weight. This sheet tells you over the course of the year how and when to change the percentage of the body weight, that you're feeding your puppy. Because it's going to start at 10% and go down until at adulthood you're feeding at about 3.5%. So your food bill's kind of going to do one of these and then it's going to drop right off. This is about a reminder for your first 24 hours with puppy. There's a couple of things you have to remember to do, your homework if you will, when you go home. So register for your free 30-day trial of Trupanion Health Insurance. Your puppy comes with a free 30-day trial. I don't make a commission on this. We do recommend carrying health insurance. Of course, it's insurance. It's a personal choice. Maybe you have life insurance, maybe you don't. It's one of those things you might pay into it for life and never use it. But accidents happen. Eating the stuffing out of the inside of a toy happens. So it's not always a question of, well, they're health tested and they're healthy puppies. Yes, they are, but other things can happen. So we do recommend insurance. At least sign up for your free 30 days because that gives you the time then to go over their policies and procedures and their different packages so that at least your puppy is covered while you decide. Register as a pet. Sorry, we had to pause there, so hopefully this is still running smoothly. So we covered the Trupanion Health Insurance. The next item for within 24 hours is the ALAA pet membership. Those documents are in your folder as well, and they tell you how to sign up as a pet member with the ALAA. It's all done online. There is a small fee, and it does explain to you what the fee is used for. They send you your pet's official pedigree, by the way. And you want to book your puppy's first vaccine and checkup. Lots of times the vets will fill up quickly, so you're going to want to do that, even before you take puppy home. Now that you're seeing this video ahead of time, but certainly by the time you take puppy home. And then there's also an envelope in your folder that says IDAP. This is puppy's microchip. So all puppies were microchipped before they left us, and you go online and you update puppy's name, your names, your address, and all of that. Then what's on here is a sample crate training schedule because of course we do recommend crate training. And if you've read this and you still have questions, do get in touch with us. We are always here for you. This is our vaccine protocol. Now remember, natural rearing holistic breeder, we don't do a lot of vaccinating. So the first vaccine, which I mentioned before, we recommend doing at 9.5 to 10 weeks. The first vaccine we recommend doing is a parvo only vaccine. If you're in Calgary, the only place that we know of to get that parvo-only vaccine is Little Creek Vet Clinic in Millrise, which I know will be a hike for plenty of you. We have lots of people on the north end and out of town, but it's something we do really believe in. After that, 4 weeks after that, it says 10 weeks and 14 weeks, but 4 weeks, you'll do the DA2PP, which is the normal puppy vaccine, distemper, adenovirus, parvovirus, and parainfluenza. So that is a parvo booster for that first one. And then 4 weeks following that one, you're going to do titer testing. Titer testing is where they take blood from your dog, they send it off to the lab, and they test the antibody levels for your dog. They either come back positive or negative, and there will be a value as well, but positive or negative. Once you've achieved positive titers for your dog for distemper and parvo, you never need to retiter or revaccinate in the lifetime of your dog. They're covered for life. Even though the titer sheet will say titer again in a year, you do not have to. We don't recommend doing rabies at all. It's not our law here. We're not in particular risk of it. If you're in Fort McMurray, you have a new bylaw, you have to get rabies. But for most of us, we're not dealing with a lot of wildlife and things. If you're on a farm, it depends where you are. You maybe have to have a conversation with your vet about, your risk of rabies. But overall in Canada, our risk is very low. And it's not really something we recommend. It's quite a vaccine. It has a lot of side effects and can do a lot of nasty things. And it's not our law here. So unless you're taking your puppy to the States on the regular, then you would have to get the rabies vaccine and decide for yourselves if that was a risk you wanted to take, because of course you can't cross the border without a rabies vaccine. This one, great dogs are not just born that way. This is all about socializing your puppy. You really only have until they're 16 weeks old to make the biggest impact in how your puppy will turn out as an adult. This is their sensitive period, and it's similar to toddlers, how they learn very quickly and they're kind of, a sponge, and everything comes very easily to them. It's the same with puppies in that time period. You can introduce a young puppy to something fearful once, and once they've recovered from it, they're good forever. Whereas doing that exact same thing with an adult who is afraid of the same thing might take 10 or 12 exposures to get your dog over it, if they ever get over it at all. Like thunder, for example, if you've seen a dog who's afraid of thunder. Our puppies get exposed to thunder while they're here, and certainly by the time they're 4 months old, they would have had thunder at home or fireworks perhaps. And you'll see they'll never be afraid of thunder. But there's a whole bunch of really great things on this. I pulled this off the Avidog website. Really good things you would never necessarily think of to introduce your puppy to, and you really should aspire to introduce your puppy to all of these things, because you'll have a really solid adult. This is just some tips on puppy proofing your home. And then this is all about why we do not do a traditional spay-neuter before maturity, and we certainly don't do it here, but even doing it at 6 months or 8 months, the dog is still not mature. So in our contract, we're asking you to wait till at least 16 or 18 months, and closer to 2 is actually better. So there's the reasons why we don't do it. If you're getting a girl from us, there will also be a document in here about getting a girl and the fact that they will experience a modified heat cycle. This document kind of explains to you sort of the very bare minimum you might see, where you may not even notice it, and sort of the maximum that you might see, where you may see a little bit of bleeding, changes in behavior and things like that. But overall, it's very asymptomatic in comparison to a fully intact dog. The females don't have a uterus, but they do have their cervix, the way that our OSS is done, and that cervix is endometrial tissue, so that's why they can have a little bit of bleeding. It also explains to you any risks involved in leaving your dog intact. This is the Trupanion health certificate for the 30 days, which we talked about. On this side will also be a copy of your contract, which I will send to you in a PDF format that you can sign it at home and send it back. That's the ALAA registration, which we covered. And then this is from your puppy's temperament testing. So you can kind of read through this and see where they scored and the kinds of things that we looked at when we were testing out your puppy. So I think that's everything. And like I said, we're always available for you for life. Just shoot us an email anytime you have questions, and we'll be more than happy to help you. And there's the We Rock group, so other families will be willing to help as well. And yeah, hope you enjoyed this video, and of course we'll see you at puppy visitation, or if you can't make that, then puppy pickup, of course. So see you later. Bye.